Can I start by acknowledging the traditional owners of the land on which we meet, the Turrbal and Yagara people, and pay my respects to elders past, present and emerging. And it is National Aboriginal and Torres Strait Islander Children's Day, so I'd also like to acknowledge all of our Aboriginal and Torres Strait Islander children who are living safe at home in culture with their family, or those who have had to come in to care. Can I also acknowledge Lindsay Wegner and Natalie Lewis in her absence, and I know we all want her to get back on her feet very quickly. Thanks for having me as your speaker this morning, and more importantly, thanks for coming together to really help explore some practical solutions to better help our ICE-affected families and keep our children safe. It is vital that we work together to arrest the rise of ICE and the toll that it is taking on so many of our families and communities. And I know that yesterday you had a presentation from Deputy Director General Marilyn Strofield about the statistics surrounding this drug and how it is impacting Queensland families and the work that our department is doing. And I'm not going to go back over those numbers, but I do want to talk about some of the human consequences of those statistics and what we are doing in response. In April, I attended the first ICE Regional Engagement Summit hosted by Premier Palaszczuk in Rockhampton. And there we heard stories that confirm what we all know. ICE is tearing families apart, domestic and family violence is often present, and children are being neglected. And this often leads to child safety becoming involved. And the speed at which social norms in parenting are breaking down following ICE use is perhaps the most alarming. It doesn't take long before they come to the attention of child safety. And we also know that families battling ICE addiction are also experiencing multiple other issues, mental illness, domestic and family violence. And this complexity provides an enormous challenge for all of us and for our dedicated frontline child safety officers. And as I visit child safety centres across Queensland, child safety officers speak with me about these challenges and the alarming influence of ICE use in their community. And just last week I was at a child safety service centre and I go around to all the different teams and I say, look, what are the challenges you're dealing with? And ICE and domestic violence are the two big ones that they are confronting each and every day. The challenge of the growing use of ICE and even the increased reporting of domestic and family violence was not something that was forecast in the roadmap provided by the Queensland Child Protection Commission of Inquiry. Indeed, the 2013 report discussed alcohol and drug addiction interchangeably, noting at the time that alcohol was the most common substance misused by parents with children in the child protection system. And less than 5 years later, that has changed. This challenge has been one that has emerged and one that we have been quick to identify and respond to. And it's why we are delivering the biggest injection in frontline staff in over a decade. Almost 300 extra staff will be employed over the next 2 years, and that's on top of the 129 staff last financial year. And many of these new staff will be working in the areas most affected by ICE, as well as working with closer cooperation with our key government partners in hospitals and with police. And as part of a new improvement program, 2 practice leaders, one a leader for alcohol and other drugs and the other for mental health, will assist the capability development of staff and system responses to families struggling with those issues. We are of course continuing to progress the 10-year Supporting Families Changing Futures reform program to continually drive improvement in the child protection system. And of course those reforms have such a focus on early intervention and prevention with the rollout of our Family and Child Connect and the intensive family support services. And these services are being boosted with new nurse positions to provide specialist advice and support on alcohol and drug addiction and mental health. These services and the new domestic and family violence services we are putting in place are helping parents struggling with substance abuse issues. Most importantly, we're working with families to keep their children safe. And to help families keep their children safe, our staff need a range of options, particularly where drug users are concerned and when we are working voluntarily with parents in their home. That is why, in an Australian first, we have implemented mandatory drug testing for parents working with us on a parenting agreement where drug use is suspected. And I know there's been a great deal of discussion from the panel yesterday about this policy. And I do want to stress, of course, it's not our only response to the growing use of ice in our communities. Drug testing is never done in isolation of staff exercising their professional judgment. And to help, we have developed and implemented mandatory online training about ice as part of our ongoing practice development for both new and experienced child safety staff. We have worked with Queensland Health and the Queensland Police Service to design this training to help child safety staff recognise and respond to the signs of ice use in families. But of course, this isn't just a challenge for child safety. We are providing a whole of government response with our Action on Ice plan. The plan is supported by an $18 million package in the state budget, including $7.4 million to target families affected by ice who are involved with the child protection system. $1.7 million of this will be invested in partnership with Lives Lived Well to support the operation of family recovery units in Logan for ice-addicted parents. So again, this is really an Australian first. This new residential facility will be for dedicated families who are involved in the child protection system to help them overcome their ice issues while not having to separate the family. And it's important to say that these initiatives should give hope to people who are struggling with ice. And we know from stories like Anne Elder, who is a brave recovering ice user who has worked with us to tell her story, that people can heal and overcome their addiction and become better parents. Anne recently spoke out to tell her story about how her several times a day addiction had her on the brink of losing her children, about how that drove her to seek help, and how the help led her to now be free of this terrible drug and successfully raising her wonderful children. So there is hope. There is hope for those who are caught in an ice addiction, and we want to provide the services that will help families break that addiction. We want to bring hope to as many struggling families as possible. The evaluation results of this pilot will be valuable in determining future service responses for other parents like Anne and their children. We know we need a whole of community response if we're going to successfully counter the impacts of ice. This isn't something the government or that child safety can do alone. And that's why our Action on Ice policy also includes $5.4 million to deliver universally accessible support to families of ice users to get the facts and where to go to get help. So I'm looking forward to releasing a tender later this year for up to 10 service providers across the state to be trained and funded to deliver this program. We know that tackling the use of ice by parents will create a safer and stronger Queensland community and help keep our kids safe. And that's why I was so pleased when Lindsay came to meet with me and talk to me about this symposium. These 2 days are an opportunity for all of us involved in keeping kids safe to hear the facts, explore the impacts, and discuss solutions. The outcomes will not just be provided back to me, they will also feed into the whole of government process underway in the Action on Ice plan as a key submission regarding the child protection and family support system. So, things that are being discussed here today, your views will absolutely form part of the whole of government strategy to tackle ice. So I'm looking forward to hearing more about the strategies and solutions that are discussed and developed here over the next day. And I want to again take this opportunity to thank Pete Care and Quatsit for providing leadership on this issue and organising the event and bringing everyone together. And my thanks also to all the presenters and panel members for generously giving up their time to share their expertise and share their experiences. Thank you.